Okay, this is a report on home health care by Bernie Brennan and Camilla Weaver. Um, we looked into the benefits of home health care. Home health care allows the patients to stay in their own home, which lowers the costs from having to go to a nursing home. One thing I found interesting that I didn't know before when I researched it was one of the benefits of home health care is it provides a safe place from contagious infections. You're not around other sick people, so you're not likely to get sick. It's also easier for family and friends to visit their loved one and allows freedom of independence of the person. And normally, nursing homes, very program centered. Uh, In home health can be tailored to the specific needs of each person.
Sorry, it's still loading for me. So personal care aides versus the home health aides, really what's the difference? So we looked into home health care assistants can be divided into two different areas. They can be personal care aides and home health aides and personal care aides. They tend to tasks such as bathing, dressing, grooming, cooking, and light housekeeping. Those are the activities of daily living. Additional responsibilities can include organizing a client's schedule, grocery shopping, helping a client enjoy recreational opportunities, and providing valuable companionship for someone who may live alone or have no formal caregiver. Home health aides share all of these important after-mentioned duties, and additionally, they take on other needs, health needs like vital signs, medications, and performing dressing changes as needed.
Okay, and we decided we'd each look into a company where we lived. I live in Kansas City, and Camilla lives in Rigby. So I looked into the Bethlehem Home Health Care here in Kansas City. The cost varies a lot by the situation. It was a hard to nail costs down without them actually doing an in-home visit and everything. So kind of the things I got were very ballpark estimates. They offer plans everywhere from 2 hours a day for light housekeeping, maybe someone to just come in, do some quick housekeeping, make the person lunch, to 24-hour care. Um, in talking to them, the most inexpensive option is to have someone who either lives with the person or have the person move in with a family member. And then you would just have a health aide there while those family members were at work or something else. Um, but overall, the cost, it is a significant savings. Um, Full home health care. So we're talking the 24-hour a day health care that they were talking about. It's normally about $3,813 a month. That's the national average. Versus nursing home costs, which national average would be $7,604 a month. Just a cost comparison, the national average per month versus what Bethlehem was saying. Basic home care, which is 8 hours a week, um, which would be just that person to come in, make lunch, do some light chores and things. You're looking at $693. That's the national average a month versus basic home care for Bethlehem, which their ballpark was 725. Also, an interesting option now that's out there is adult daycare. Um, Basically, you would take your loved one to a facility where they would have activities and they would be able to take care of them during the day while you were at work. Um, so that's another option for people. The national average on that is $1,495 a month. Bethlehem did not offer that service, so that's why I don't have anything there. Now, full home health care, that's someone who's going to be with them basically 8 hours a day. Um, was like 3,813 versus 3,650 from Bethlehem. Reimbursement rates, they were pretty close in line. The national averages in 2012, which is the last time I could find figures for, out of pocket, a lot of that, a lot of it is just straight out of pocket, is 8%. Private insurance, 7%. Medicare, 43%. Medicaid, 37%. Public assistance programs, 2%. And miscellaneous, 3%. Bethlehem, their out of pocket was 12%. Their private insurance, 10%, Medicare 36, Medicaid 27, public assistance programs was 15. So they depend a lot more on public assistance programs, and then they didn't have anything for miscellaneous. Now, one thing about home health, it's a lot like nursing homes where um, Medicare will only pay for the first 100 days after an incident or a hospitalization, kind of as rehab care. After that, it doesn't do any more reimbursements. So, probably this was for that first few days, that 43% is probably for that first little while. Then either a family member has to take over or it'll usually go to private insurance or out of pocket. Basically, what I learned by talking with them is do your homework. Definitely ask friends or families who have been in the same situation. I was thinking about, I'm a little bit older myself, so I was thinking about, what would happen if I had to find something like this for my parents. My dad's in his 70s. Um, Definitely, I had no idea where to start looking. So definitely do your homework. Um, Consider having the individual living with one of the family or one of the family live with them. Work close with your provider. One of the biggest benefits of home health care is that it can be closely tailored to fit individual needs instead of a one size fits all approach. Tell them, the likes and dislikes and the things that uh, your family member needs, and they will work really close to make sure that that patient is comfortable and gets all the care they need. And then just sit back and breathe. Most likely, this decision does not need to be made right away. Research and find what's going to be a good fit for you and your loved one.
So the place that I looked into was actually down in Idaho Falls because Rigby is a smaller town. We don't have any of these options. So I looked at Idaho Falls Home Care. And in talking to them, just like I think it was the Bethlehem, their cost is dependent on how much care and help you need, with which activities you need help with, as well as kind of the time of day. The amount of time needed, it really greatly impacts the cost. They do have help available, again, for 2 to 24 hours a day, just depending on what is needed. And the help from the family is really the best way to help keep costs down, whether they live with you or you go visit them. It really makes a big difference. And then in Idaho, other statistics or information that I found was that the average cost is anywhere between $15 and $25 per hour, whether it's an independent caregiver or an actual facility. It's usually about $19 per hour, given the more care you need and more help, the higher the cost. And then in looking at the other associated costs, they kind of put into perspective of how much home health is versus looking at an assisted living facility or nursing care home. So if you are in an assisted living facility, it's roughly about 20% more expensive than home health. So personally, if I had to find a place for like my grandmothers or my parents or anything like that to go, if you can do it, home health is definitely the way to go, just because it is a little bit less expensive and that will help you, especially in the beginning. And then in nursing care, home care, if it's a private room, it's about 150% more expensive than home health. So there's a huge difference there. And then I was looking at the home helpers homecare.com. And one of the things that they said that I just really liked was the cost of care is usually one of the main decision factors in making this difficult decision. Not only is it preferable for seniors to stay at home and age in a place, it is also more affordable compared to the cost of facility care. Hiring in-home caregivers could save you and your family thousands of dollars. And then they also have some great questions to ask. Just depending on what you're looking at, it's definitely good to look at how the different agencies train and supervise and monitor the caregivers. And continuing education is always essential, especially in healthcare. And so that's an important question to ask, as well as are the caregivers licensed and insured? Given each state is a little bit different, but if you're going to use someone, make sure that they are in compliance with the state that you live in. Another great question to ask is if you'll receive the rights and responsibilities of all parties involved. So that is known as the Patient's Bill of Rights, and it can help if you have any questions, or it can be a good place to reference in case there are any problems. And then it's really important also for the agencies to work directly with you or your loved one, family members, and healthcare providers. So it's definitely important to ask that, whether they ask you or other people that are close with that family member, what their preferred preferences are, as well as what the their doctors request. And then another thing is, how are problems addressed and resolved, and whom can you or another family member contact with questions or complaints. Finding a home caregiver is usually a first-time thing. If you have a lot of questions, the places I spoke with, they were very helpful, and they were more than willing to answer the questions you had. And then in what I learned, so if you have any questions, you can ask your doctors, your friends, other family members, board members, neighbors, anything like that, and they can give really great advice. And don't be afraid to ask questions. The home health agency will be more than happy to help you out. It isn't their first time. Even if it's yours, they've been through the ringer many times, and sometimes what's good for someone else isn't always good for you, and they'll definitely let you know. And it's really important to talk to several places. Not all agency is the same. Sometimes they offer special services, another one doesn't. And so just make sure that you check out all your options, and then definitely go with your gut and what feels best and what would be the best application for you and your family member.
So who did we pick? Well, either program would have worked really well for our family members. It was hard to, if you're going strictly off price, it's hard to nail down prices without an actual in-home visit. The thing that stood out to both of us is that most most home health professionals, they really want to find the right fit for the patient. So they're going to go out of their way to make sure the patient, your loved one's comfortable, they're getting what they need, things like that. And both of us felt that the provider we talked to would do a really good job. So we hope you enjoyed our presentation and found it informative. And we look forward to seeing your questions and comments in the user board.
As I say, if you have any questions, feel free to ask us.